And finally, we will go on to my friend, Karen Minyard, who I've gotten to know well over the last couple of years. But in fact, Karen and I sponsored a kind of a large meeting called a summit in fall of 2018, which really brought together CDFIs, rural healthcare people, Office of Rural Health people, rural serving nonprofits from throughout the South, really in service to this idea of the connectivity and the mutual interest that we all have working in the same places, but often not understanding each other's language, which became one of the outputs of the meeting. It's just the language that we all speak was so foreign to each other in many ways. So Karen has been the director of the Georgia Health Policy Center since 2001, is a research professor with Georgia State University. Karen connects the research, policy, and programmatic work of the center across issue areas, including population health, health philanthropy, public and private health coverage, the uninsured. She has been leadership roles in projects at the center, too many to mention, I would say, but that encompassed evaluation, policy and economic analysis, healthcare financing, and on from there. So we welcome Dr. Karen Minyard from Georgia.
Hello, I'm happy to be here with you today and to talk a little bit about innovations in sustaining rural population health. I'm going to talk a little bit about the rural landscape, about the key domains of rural, about a little bit about what's on the minds of some folks in rural communities right now as they've been in the challenge of a century, share with you a sustainability framework, and talk about innovations in financing. So one of the things that I wanted to say in thinking about the rural landscape, and I'm sure this was talked about, I noticed it some yesterday and today, is that some people say when you've seen one rural community, you've seen one rural community. Other people imagine that all rural communities are alike. And I think it's something in between, that there are many subgroups of rural areas that share historical, cultural, economic, and geographic commonalities. Catherine mentioned the colonias or the tribal nations. They are each different, but they do share some of the same things. Also, some of the areas that have similar economic underpinnings might have some similarities. So we can sometimes kind of think about rural in not all the same, not all different, but something that's a little more complex in between. We think about these four key domains of rural, and so there's the infrastructure, which would be things like the economy and the broadband and policy, the healthcare system, which would include accessibility and insurance and workforce. The environment, which is broadly defined, all of these are broadly defined to include the built and natural environment, the climate, exposure, safety, housing, and then overall the population, the culture, the demographics, the history, the mindsets. It was interesting when Catherine was talking about the complexity that these rural development hubs might cover these different areas. I think we could have used her picture or this picture to tell this story of the complexity of all the things that need to come together in a rural community. So I wanted to say a little bit about some work that the folks at the Health Policy Center did recently. At the beginning of our experience with COVID, they brought together nearly 200 different rural grantees and kind of crowdsourced with them. What are you thinking about? What are you worrying about? What's going on? What do you need help with? Who would you like to talk to someone? What would you like to talk to someone else about? And these are some of the key things that came up for them. One is we have a lot of work with community health workers, and we need to pivot this to a virtual world. How do we deliver effective virtual trainings and meetings? We have a lot of peer support services, particularly around issues of the opioid epidemic. How do we handle that peer support in our current environment? Can we use telehealth in new ways to meet the emerging needs? Our data and collection and evaluation is not set up to account for what we're experiencing right now. How do we quickly adjust the information that we're collecting so it'll be relevant? And what about working with schools or other key partners in our communities? It's interesting that I guess one of the headlines that would come out of the innovations that are emerging rurally, the first one would be we're going through a technology trial by fire. We have issues with inconsistent internet and cellular service, households without internet, lack of technology for virtual visits. Even when it's available, maybe not everyone is comfortable with the experience of using technology. Some grantees were in the midst of going through modifications of their electronic health records and other reporting systems, and how does that get handled? But out of these challenges, which have always been in rural communities, a lot of innovation surfaced, and things that maybe hadn't been able to happen before. Using Visuel as a telehealth platform that provides for switching to low bandwidth, suggesting that people go to, I don't want to advertise McDonald's, but go to McDonald's or other retail to use the Wi-Fi. In Ohio, they provided a map of all the rural cell phone towers. They started using some Facebook Live, and I'm hearing about that more and more, the use of Facebook Live in a way that helps people. And also the concept of having a drive up of someone outside your house or where you live with a hotspot so that you can have a connection. They also started thinking about putting COVID measures in electronic health records. And they were trying to figure out, so what are we going to do about our work with correction facilities? Because we can't go in there. But they began working with the corrections and probations officers in order to try to meet the needs that they were having. They also, in some places, have implemented school bus delivery of meals, and they expressed a great appreciation to how much flexibility that they have with their HRSA responsibilities in their grants from the Federal Office of Rural Health Policy, because some of them are beginning to experience states cutting supports. So having that flexibility on the federal side kind of eased the challenge a little bit. One of the surprises that came up for them was, in some cases, was a lower no-show rate when they had telehealth. They expressed some things that are going to be important going forward is being able to keep up with the new policies, information, and changing regulations, taking advantage of expanded opportunities in telehealth, and a little bit of fear, like, are we going to lose this expanded telehealth that we're learning how to use and that is helping us? Creative strategies for outreach and connections with clients, incorporating their new measures, the big themes, disparities, creativity, partnership, and technology. So that's just a little snippet of a window into some of the thinking that's happening on the ground. So now I wanted to talk a little bit about sustainability. And a number of years ago, the Health Policy Center created this sustainability framework. And in the sustainability framework, there are really two parts. One is sustainability isn't at the last minute when you figure out how you're going to get your next grant. It's a much more complex process of positioning for sustainability. And through our practice and the literature, we identify these key components that are important to be positioned for sustainability: having strategic vision, collaboration, leadership, relevance and practicality in your work, evaluation, communication, efficiency, and capacity. When I heard Rhonda talking about her work, it sounded like she was putting many of these things into practice in thinking about. So you can, I can see why your work, Rhonda, is sustainable, because you've got these things in place. For example, the toolkit is an example of being relevant and practical. And your recommendations for adoption, that process, is a very important evaluation component. I was listening to Daryl, and he was talking about the work that they're doing on thinking about the community health needs assessments, which demonstrated strategic vision, collaboration, and evaluation and ROI. So these things are all showing up. I was going to tell just a quick story about something that happened at the Health Policy Center in the last few weeks. The Health Policy Center is in the Andrew Young School of Policy Studies. And when George Floyd was murdered and all the surrounding events, we asked Ambassador Andrew Young to meet with the 90-member staff of the Georgia Health Policy Center. We asked him to give us his thoughts about the civil rights movement and to give us advice. And I was going to share a little bit about his advice and how it maps to this sustainability framework. He said, "We don't need your bodies right now, we need your minds." He said, he talked about Birmingham. He said, when Martin and I, he was talking about Martin Luther King, when Martin and I went to Birmingham, we called it Bombingham because there had been racially motivated bombings there. And we recognized that we were in it for the long term. And we spent 3 years building relationships with business, having nonviolent protest, and economic withdrawal. And everything that we did was very planned and organized. He said Martin Luther King did not go to jail unless there was a strategic reason for him to do that. And so when you think about, he said to us, my advice to you is to imagine, what does victory look like? And what are the specific issues you want to take up? So that's saying, have a strategic vision. That's saying, showing about the collaboration and the relationships that were built. And so he, in a lot of ways, was building something in Birmingham that was very sustainable. And he was talking about how some of what was built all those years ago is still there and makes Birmingham a better place as it relates to racial relations than it would have been if they hadn't been there. So this is about being prepared. The next thing I want to just talk about is the money. This is about show me the money. Where is the money in the system? How do we have the money to do what we want to do? And how are we innovative about the resources? When we were doing this work with the Robert Wood Johnson Foundation over the last 6 years, we built this blueprint for action. And it was about creating a culture of health and the kinds of things like stewardship and strategy and thinking about the money, like how much do we need? Where does it come from? How are we going to organize it? What is the ROI? How would we administer it? And how do we do that with a thought toward all the issues of equity? Because what we found is when you see that little triangle down on the right where it says financial instruments, people were rushing to think about the financial instrument, like maybe pay for success or some other kind of financial innovation. And they didn't have all of this built. I would think that maybe this kind of information could be a complement to Catherine's thinking about how to build a hub, because when she talked about this, she mentioned many of these things. When we were doing this work, we had modules on stewardship, strategy, equity, financing, and we got done with it. The 7 communities that we were working with at that time said, well, that's great for us to know this, but what we really need is somebody to help us get in action. So we designed for them, at their request, an innovation acceleration process that they went through that had them defining and agreeing, and that's said lightly maybe, but when you really watched it in action, agreeing about what you're going to do sometimes takes a lot of energy. Ideating about what it might be that they would do, developing prototypes, testing the prototypes, and implementing them. And when they did that, they did actually come out with financing innovations, and they kind of zeroed in on this concept of local wellness funds, which is a vehicle for bringing all the money together. I think the hubs could have a local wellness fund if they chose to do it that way. But there are a lot of different sources for money. Where does the money come from? It comes maybe from banks, maybe from chambers, maybe from an unlikely hidden place in the local government. There's a lot of opportunity that people don't really think of. And I think sometimes when people are coming from the health care or public health perspective, there's not a broadening of view about where is the money in the system, and this talent of being able to see the system and see the money. And then there's the whole issue of deciding what the funds would be used for, and then what is the structure that would manage and administer and provide stewardship for these funds. Some of the things we learned, that there can be a fascination with financing mechanisms, but that's not a substitute for understanding the flow of money in the region. Community collaboratives embrace an evolutionary rather than a revolutionary approach, and they have to answer the questions about sources, uses, and structure related to the money to support their work. And if you focus only on the programs and don't spend enough time maintaining a focus on the financing, it's often critical to keeping you from getting going. So I want to do a little exercise with you. One of the things about seeing the money in the system, Catherine talked a lot about these different sources of money that are ones that are not the usual suspects. And it takes a way of thinking to be able to open your mind to see the money in the system. So I want to see, this is a little practice on how to open your mind in that way. So I'm going to ask you to review the image on the next slide. It represents a common phrase. When you know the phrase the image represents, write it down for yourself. Don't put it in the chat yet, and await further instructions. So here's the image on the left. It's a common phrase. Let's just take a moment and see if you can see what this common phrase is. You may be able to enter your answer in the question or chat box, but I'll just show you the answer. Mixed greens. So this is an exercise of thinking about seeing beyond the obvious. And we think about the money in the system being at the macro level, like somebody who can be in a community and just kind of scan. In one community we had, it was a rural community actually, and the rural banker stood up and said, I see the opportunity. I see how we could put my money from the bank, the CDFI money, the money from the community benefit at the hospital. I see how we could put that together in a portfolio of different levels of loan and grants to accomplish what we want to accomplish. And once he saw that vision, it sparked everybody to think about the money at this macro system level in a different way. We've also seen people who are able to see micro money in the system. For example, in one community, there was some money in the local government that was allocated for labor. And the project was community health workers. And so they went to the local government and said, we're doing this work with community health workers. We think it's a labor type project because it's developing these folks to do these jobs. Instead of putting that money back in the general funds because you haven't spent it yet, could we use that money for our project? And they said yes. So there are people who naturally look at the macro system level of money and the micro system level of money, and we call these people money whisperers after we began to see them in community after community. I would probably call Catherine when she was talking. I thought, oh, she's a money whisperer. That's what she's doing. She's looking at the money in the system and she's thinking about how it all can flow together or come together. Some people just do this naturally. Some people have developed their skills. I have a PhD in business, so I focused a lot on issues of money and financing. But all of us can learn to do this. All of us can open our minds to seeing the money and thinking about how it can come together. Alan, the meeting that you were talking about, where we brought together different groups of philanthropy and CDFIs and state rural health folks, that was an opportunity to look at the money in the system in a different way and to think how it might be used to accomplish our population health goals. So when you think about this situation of innovations in financing, which underpins the framework of positioning for sustainability, I would recommend some steps. And one is to move thinking upstream. This whole meeting is about population health. And so I would say move the money upstream, look at the money in the system, build stewardship among thoughtful groups of people from different sectors, explore different financing vehicles and sources of money, look for the intersections of health and the money and the partners, and invest together. Invest in a small project work first, and then repeat, repeat, repeat. So thank you.